Hi everyone, I'm Dr. Faisel Syed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege.
Today, we're talking to Dr. John Franko from Tower Health and Reading Hospital about physician leadership development. Let's dive right in. Hey, John.
Hi, Dan. How are you?
Good. Well, it's great to be here with you. So I'm with Dr. John Franko, who's the chair of family and community medicine at Tower Health, and I think associate chief medical officer, and I'm sure a professor of family medicine, and also the president of the Association of Departments of Family Medicine as well, correct?
Correct. Yeah.
Cool. Well, anyway, our audience, at least the audience that we want to direct to as much as we can, are students and residents interested in primary care. And so usually we start off with just sort of your origin, a quick origin story of what led you to medicine, what led you to primary care, and what led you to where you are now.
Well, gosh, that could be a long story at my age. I was first interested in medicine in high school. I had some athletic injuries and had early surgery on one of my knees. And for those who are familiar, back in the day at the University of Virginia, Dr. Frank McHugh was the sports medicine orthopedist who took care of me and took me to his home the night before my surgery, where I spent the night, and I went in with him the next day, and he operated on me and I went home. So it was one of the first kind of outpatient surgery opportunities developed in the country, and it was for young athletes with sports injuries. So that got me interested. I ended up back at the University of Virginia for medical school, went to Roanoke for my residency. I had a National Health Service Corps scholarship, spent the first few years in practice in a town of 1,500 people in Chatham, Virginia, and then opened my own practice in the nearby city of Danville, where I had hospital privileges after I finished my initial National Health Service Corps payback. After that, established my own practice. We went from 0 patients to 10,000 charts in 4 years and paid off all my debt and thought, well, what's next? And what was next was a serendipitous cold call to Mike Coates at the University of Virginia, who had been my faculty advisor, and asked him about getting into academics. And he said, we're looking for somebody like you here now. And 6 months later, I was on the faculty at the University of Virginia, where I spent 13 wonderful years, all of them working with you, Dr. Dan, and a variety of other really amazing people who I learned so much from. After that, I decided I wanted to be a department chair, and our chair at the time wasn't going anywhere. So I interviewed at a couple places and was offered the job at East Tennessee State University. Went there and was chair of family medicine for 9 years. Again, got a little bit of an itch at looking at something different, and an opportunity at Atrium Health in Charlotte, which is one of the largest not-for-profit healthcare systems in the country, had a little bit different take on education, and it was education of residents and medical students in a non-university affiliated academic health center, or a non-university owned academic health center. And was there for 3.5, almost 4 years, and decided that again, got the itch and moved here to Reading, Pennsylvania, where Reading Hospital hired me as the chair of family and community medicine. We're part of Tower Health, which was a growing healthcare organization at the time. And I moved here in January of 2020, and we all know what happened in March of that year. I came to grow a department of family medicine, an academic department. We're affiliated with Drexel University, where I have my professorship now. And that was not in the cards at the time. And looking for other leadership opportunities, I interviewed for associate chief medical officer and was chosen for that position here. So I have a dual role right now, involved a lot with the parent organization Tower Health on a lot of committees, with Reading Hospital on a number of initiatives, and then the Association of Departments of Family Medicine. I've been a member since 2007, so it's 15 years now. And they, for better or for worse, for both parties, elected me president-elect a year ago, and this is my president year. And then next year I'll be chair of the board of directors. So that's my little backstory.
Well, that's great, and I know when we talked about you coming on the podcast, really wanted to talk about physician leadership, and I
Hmm.
remember having conversations. You mentioned that we worked together, and I know we worked with Dr. David Slauson, and we would go over to Little John's on Wednesdays and eat lunch and talk about
Hmm.
all the problems with healthcare. And it's interesting. I know that you. Have had a real interest in leadership development. I mean, you've got some of the former people you've worked with are in leaders around the country as well. So what I, I I've said often that um, my generation, our generation of doctors, many of us bought into the idea that the administrators were going to run the business and the doctors were going to practice medicine, yet whoever runs the business is really determining how medicine's being practiced. And you were very much a forward thinking about that and about the importance of doctors learning to manage the business. And so what are your thoughts about the importance of that, especially in the future of healthcare?
I think it's critical. And one of the things that I often say to talk about with students and residents when talking about this issue and leadership is that the the financial part of what we do is extraordinarily important, obviously, because if we didn't have the resources, we would not be able to take care of anybody. And so that's important. And yet there's a really delicate, it's very delicate. You would think it's not, but it's a very delicate balance between having a health system or an organization being a health organization or a health system, or on the other side of that, a health system just being a business that happens to do medicine. And so I think that's a really important distinction and a really important balance. And if the physician leadership is not at the table when the financial decisions are made, so in the budgeting process, every organization goes through a budgeting process annually. If the physicians are not at the table, then decisions are made about clinical programs, productivity, uh, measuring what people are calling quality or performance measures. All of that is decided as they're making the budget. And if we're not at the table, certain very important things might be left out. And we see that all the time. That the management team, if they don't have physicians there, it can be really problematic because they don't quite understand exactly how medicine is practiced, how it's applied, and how, while there are very important system-wide and system-wide issues that need to be standardized, each individual patient is a little bit different and each situation is different. Patient preferences are different. Their reactions to treatments and side effects, allergies, all of that has to be taken into account by the person at the bedside, that it's hard to aggregate in a budgetary fashion.
Yeah. Well, and I know you've done a lot with putting together leadership development programs.
Mhm.
I mean, what do you think the most, if there is, what are the two or three most important things for a physician leader to learn, especially one starting out in leadership?
Sure.
It's aside from doing it your way, and I know. I mean, I remember very clearly you telling me that, and it was very profound at the time that a leader without followers is just some guy going out for a walk. I mean, it really is about getting engagement from your team as you move forward. But I just wonder what you've obviously been successful at developing these programs. So what are the keys that people need to learn?